Many people ask me about the COVID-19 vaccine and my thoughts on it, so I'm going to give you some thoughts. Before we start, here's the disclaimer. Anything I say here is not medical advice. Anytime that you have any questions about what to do and what not to do regarding your health, always talk to your doctor first. It doesn't matter if you're going to start a new supplement or increase or change your exercise or vaccination thoughts, whatever it might be, changes in medication, always talk to your doctor first. This is not medical advice. And as I move along here, I'm going to share with you information from the research and from respected medical physicians in the field. This is not an anti-vaxxer video here. I'm not going to be talking about nanobots and people trying to take over the world and so forth. That's not what we're talking about here. I'm going to talk about some science, and I'm going to talk about some important comments that Dr. Zubin Damania has made, Dr. Paul Offit, Dr. John McDougall, and Barbara Lowe Fisher. So I'm going to talk about people that are entrenched in this and that are looking at this stuff and that are very scientific and thoughtful on their comments. So starting with Dr. Zubin Damania. Now, his website and his YouTube goes by ZdoggMD because he has a bit of uncharacteristic name in there, right? So on December 4th of 2020, he has a video where he interviewed Paul Offit. Now, Paul Offit is many of you know his name now. He's very prominent on the news now. He's talking a lot about the vaccination. Huge background, massively just intelligent man. He's the director of the Vaccine Education Center and professor of pediatrics in the Division of Infectious Diseases at Children's Hospital of Philadelphia. Wow. He's an internationally recognized expert in fields of virology and immunology. Okay. And as I get into this, they were using some terms in here I thought was really good between ZDogg and Paul Offit. They called it, as people are talking about these things and getting emotional, team apocalypse and team denial. Team apocalypse and team denial when it comes to COVID. So it's probably somewhere in between, right? That's the point that they were making. Here's the question at the 39-minute mark of this particular video, and I'll put it in the show notes and so forth. Is it ethical to mandate the COVID-19 vaccine? Now, here's Dr. Zubin Damania asking the question to Dr. Paul Offit. Is it ethical to mandate the vaccine, meaning making it mandatory to everybody? Dr. Offit says, you can't mandate something that is incredibly short supply. Now, that's 5 weeks ago that they're saying this. It still is in short supply, but there we go. His second point was, I don't think you can mandate this until you feel very comfortable you don't have a rare side effect. This is a novel technology combating a virus that continues to surprise us. I think we have to be humble here. May learn something in the next year that we don't know now. I don't think you can mandate it. We are not mandating it at our hospital for these two reasons. Dr. Paul Offit is saying that about the vaccination. Extremely pro-vaccination, probably has already had it himself. I know Dr. Damania has had it himself, more on that in a moment. But they're all actually saying, I don't think it should be mandated. Dr. Damania responded, that makes perfect sense. I'm a bit of a libertarian, and I don't think we should mandate. I think there's enough people who will want to take it and others who will do a risk-benefit analysis. That's kind of big point number one. I think regarding the vaccine is people can do a risk-benefit analysis. Here's Dr. Damania talking about himself. I'm 47 years old, I have a clotting disorder, and this virus can cause clots. And I'm a healthcare professional, so I would elect to take the vaccine with, now listen, follow his words, with a 1 in a million risk of a serious adverse event, say, let's just make that up. In my mind, the risk from an adverse event from the natural wildlife type of infection, meaning you go and get exposed in nature, are a little more scary and higher for himself. So he did the risk-benefit analysis on himself and said, I've got this disorder, I'm 47, I'm a healthcare professional, I'm going to go get the vaccine, okay? Now, in another video, he said, maybe somebody who's 20 years old, has no comorbidities and not obese, maybe decides not to get it, but somebody who's 60-year-old and has diabetes might decide to get the vaccination, okay? Whether people get, now this is very interesting too, Dr. Damania is talking about this, whether people get wild type and generate immunity that way, I think we will get to the goal without having to force people to take the vaccine. Do you agree? So he's passing the question from himself, Dr. Damania, back to Paul Offit. Paul Offit, agree. If this vaccine holds up with the efficacy we see and it holds up with safety, so what he's suggesting is has it necessarily held up for safety because the research trial is this big and the human population is this big with a lot of mix of people in there. Keep in mind there are 26 million frontline high-risk people that will get this first. That's where we're getting it right now, right? So more data will keep on piling in. Now, so point one is doing a risk-benefit analysis, and some of the top docs talking about this is saying, we think it's important, we think you should get it, but we think it should be not mandatory. Point number two is Barbara Loe Fisher. Now, Barbara Loe Fisher has organized the National Vaccine Information Center, NVIC.org. And she had started this decades ago, and she started that because she has a vaccine-injured child. Okay? She has testified in front of Congress. She's the real deal. She's got great information and so forth. She has been talking about medical freedom for decades. And that's point number two is, I think what they're suggesting here is there should be some medical freedom in this decision-making process. Also, as Barbara Loe Fisher is talking about, is there should be very appropriate informed consent, letting people know that there could be a problem. Although very small, there could be a problem, as you could hear from the comments from Dr. Offit and Dr. Damania. There could be a problem. It might be 1 in a million, whatever the number is, but we just all need to know that. So they're not completely safe is what the point is everybody is making here. Okay. Just another comment from Dr. Zubin Damania. He said this on a video that he did on the 7th of January in 2021. He says, I respect you if you have decided not to take the COVID vaccine after rational thought. That's a statement right out of that video. And you can go to his YouTube page and catch up on all the quotes that I'm giving you right now. So let me move along to Dr. John McDougall. Dr. John McDougall is a medical internist. Dr. John McDougall, I've talked about him for a long time. He is one of the ones, I read some of his books over 30 years ago on the relationship between nutrition and health and wellness and disease prevention. Great books, great program. He's helped me. He's helped many of my patients. He's helped probably hundreds of thousands of people now. And he has an article. Now, I'm going to back off a little bit. I'm going to talk about flu vaccine, seasonal flu vaccine for a moment from Dr. John McDougall's standpoint. And then I'm going to bring it back into the COVID-19 vaccine, okay? So here we go. Dr. McDougall, 2014. I recommend that my patients of all ages not take this incessantly promoted immunizations, primarily because of their lack of effectiveness. Flu vaccine now. Now listen, I'm going to spin right down and let you know, aside from flu, I do believe in vaccinations, says Dr. McDougall. Mary and I, his wife Mary and I, and all of our children and grandchildren are fully immunized against once common threats. But he's very concerned about the additives, especially the aluminum, and he'll mention mercury in a moment, found in many of these preparations. Safer and more effective vaccines are definitely needed, and that was only 6 years ago, in 2014, that he's writing this. Immunizations, along with improved sanitation, adequate food, less starvation, and possibly antibiotics, have been important advances that have reduced human suffering. To date, the flu vaccine cannot be added to this short list of medical achievements. And he mentioned about aluminum added to vaccinations. Again, he's a medical internist, and he believes, as you can see right here, he says, I believe in vaccinations, but not the flu vaccine. And in a moment, not the COVID-19 vaccine, at least yet. We're told that aluminum is proven harmless. That's not true. The toxic metal can cause all kinds of problems in the nervous system and so forth. Okay. He says, continuing Dr. McDougall, there are some risks from influenza vaccines, including injection site pain, allergic reactions, fever, fatigue, headaches, and narcolepsy. Multi-dose virals of killed vaccine contain the well-established toxic metal mercury thimerosal. I'm just stating what Dr. McDougall is stating here 6 years ago. And reported harms of thimerosal on human infants or children include death, malformations, autoimmune reactions, developmental delays, and autisms. Keep in mind, this is a little side note for all of you, and I've talked about this with my patients. Single-dose influenza vaccines are mercury-free. Single dose. You can request single dose. Why do we do multi-dose? Save a couple of pennies. Single-dose flu vaccine, if you're going to get it. I don't know. I haven't looked up the ingredients, and actually I have looked up the ingredients in the COVID-19 vaccine. Haven't seen any of the preservatives, mercury and aluminum in there yet. Don't know if there's going to be something else moving forward. Here's why Here's another reason why Dr. McDougall says he and his family, he recommends to his patients full vaccinations, except for the flu vaccine. He says the ineffectiveness of commercially produced influenza viruses is said to be primarily due to the formula consisting of materials derived from 3 or 4 viruses selected from previous outbreaks occurring over the past several years. A close look at the scientific evidence generated from past campaigns to prevent widespread influenza reveals disappointing results. And that's why he says that. The data, he says, I'm a scientist, I look at the science, the data's not there for the seasonal flu vaccine. Okay. Then I'm going to fast forward a little bit to a video he did in December 15th of 2020. So you can go to Dr. McDougall's YouTube page. It's a great video. It's pretty short. I think it's about 14 minutes. He did a really good job on this. He actually speaks really well. So this is it. Your Best COVID Defense is the title of the video. He says, this is Dr. McDougall introducing himself to you. I've been studying and talking about the effect of diet on diseases for over 40 years, almost half a century. I've had 12,000 patients. I've earned the right to talk to you. So that's what he said. Maybe there will be a COVID-21 or a COVID-22, says Dr. McDougall. Frequent pandemics, listen, this is so amazing he said this in here. Frequent pandemics now in current age are a direct consequence of climate change. Ultimately, we need to correct climate change. Interesting, Dr. McDougall. Thank you for that. Now, one of his reasons that he backed off of vaccination situations and then moved forward with the vaccinations we talked about, except for the flu vaccine, is back in the 1970s, remember, he was in full-time practice at that point. Back in the 1970s, I took care of swine flu vaccine patients. 2 of my patients got transverse myelitis from the vaccination, and the rest of their life was in a wheelchair. So I believe in vaccination, but not the flu vaccine. Now, this is the last comment that Dr. McDougall made, and I agree with him very much on this. The health you are in will determine how severe the infection will be in your body. Maybe that should be the mandate. Let's mandate healthy living, right? Just briefly, keeping in mind, some of you, if you know the history of the swine flu vaccine, which had trouble with it, and back in 1976, I pulled up this article from the LA Times in 2009, so 11 years ago. More than 40 million Americans, 25% of the population, received the swine flu vaccine before the program was halted after 10 weeks. This is back in 1976. More than 500 people are thought to have developed Guillain-Barré syndrome after the vaccine, and 25 died. So there was a problem with that vaccine. I'm not saying other vaccines nowadays are as dangerous as that one was, but here it is. Here's the swine flu vaccine of 2009. So again, only 11 years ago, 2009. In the United States, 46 million doses were given in 2009, with 3,100 adverse events were reported by the CDC. The CDC stated that the vast majority of these were mild and about 1 serious adverse event in 260,000 doses. The point I'm making here is it's not completely safe, and we need to have informed consent that there are some rare but potentially problematic side effects with these kinds of vaccinations. And there should be some determination, as Dr. Damania said, if you could make that risk-benefit analysis on your own. Medical freedom, if you will, medical freedom. In Japan, 2009, 15 million people vaccinated, 1,900 cases of side effects and 104 cases of death. That was Japan. France, same year, 5 million people vaccinated, 2,600 cases of side effects, 8 cases of intrauterine death, and 5 cases of miscarriages were reported after vaccination. So again, it's just some information to consider as people are moving forward. Just information is what we're talking about here. So I made the example here. What should we mandate? I'm using that very loosely, not mandating this, but what should we really talk about? What is the best flu shot to have? Dr. McDougall said the best flu shot you can have is by eating a clean diet, making sure you don't have comorbidities and chronic diseases. It's been well established that anyone that gets exposed to a seasonal flu virus, old COVID-19, if you already have a chronic disease, your risk of more severe infection goes way up, and unfortunately, risk of death goes way up. So what I think we should be talking about as a nation and as a world is improving our overall health and wellness. That's going to be one of the best flu shots that we can take. And the beauty of doing health and wellness techniques, in a moment I'll cover those, is there's no downside. Improving your health, there's no downside. Improving your health for the most part doesn't cost anybody any money. And that's great. So what I talked about was Dr. Anthony Fauci, and I mentioned this on previous videos as well. Dr. Anthony Fauci takes 6,000 international units of vitamin D per day. Maybe we should mandate vitamin D, right? He said, the literature is very clear. There is plenty of studies out there that says if you are vitamin D deficient, your risk of severe infection from COVID-19 and seasonal flu goes way up. And he said, I got my vitamin D tested, it was low. I took vitamin D, it's now normal. I take 6,000 international units per day. He also takes 1,000 milligrams of vitamin C per day. He wouldn't say that or do it if he didn't think it was important. Dr. Anthony Fauci, on another interview that I talked about in a prior video, he said, the 3 most potent things that you can do to strengthen your immune system costs nothing. What are those 3 things? Eat a healthy diet, get regular rest and better sleep, reduce your stress. Dr. Anthony Fauci, the 3 most potent things that you can do to strengthen your immune system, which is going to help you defend yourself against COVID-19, seasonal flu, anything else, are free, and you can do them right now. One of the infectious disease experts out there on the planet. Interesting. So there's 3 things right there that we can do. And I was going to talk about, actually we're running out of time there, so I was going to talk about some other videos from Dr. Zubin Damania, but let me leave it at this. I'm going to expand Dr. Fauci's list of the things that we can really do to improve the health and our response of our immune systems as individuals, communities, people around the world, is adding to the healthy diet and regular sleep and reducing stress. I'm sure if I asked him, I'd say, what about regular exercise that's appropriate for the individual? He'd say, absolutely, exercise has been shown to activate the brain and stimulate the immune system and so forth. That makes sense. There's 4 things. And I would reiterate with him, vitamin D, vitamin C, says absolutely vitamin D, good data on that as well. So then I'm going to put in healthy supplements as the 5th thing that we can all do to improve our immune system's function and to fight and combat viruses and so forth. So we can do the supplement thing. And I also talk about taking care of the spine, because we know that the spine is integrated into the nervous system and brain function. So taking care of the spine, being a chiropractor, I'm going to say take care of your spine. I think that this is better for your brain, and the brain has influences on your immune system, than this. So taking care of your spine, making sure it is well cared for, makes sense to me as well. There's 6 things that we can do immediately to improve our overall health and wellness, reduce our chances of having a chronic disease, or if we have one, we might be able to battle our way back to not having that chronic disease anymore, would save trillions of dollars in healthcare costs, and it would actually help us respond better to outbreaks like this, like COVID-19 and seasonal flu and so forth. And the last point is, as Dr. Fauci said, if we reduce our severe infection rates by improving our overall health, we reduce the burden on our hospital care system and the doctors and the nurses and the hospital staff, which will just help everyone. I'm Dr. Scott Fuller.